Hello, everyone, and good evening. Thank you for joining me tonight. I'm excited to present to you an introduction to red light therapy in the dental practice. It is 6 p.m. Central Time and 7 Eastern and 4 Pacific. So we're going to go ahead and get started because I know your time is valuable and I have a lot of information that's meaningful and valuable to myself, and I hope it is to you by the end of this hour. So, a little bit about me. I'm originally from Southwest Kansas. I am a current member of this Texas State Board of Dental Examiners. I'm a past president of the Hygiene Association. I've got advanced proficiency in laser certification. And I love learning new technology. And that's one of the reasons why I got started into photobiomodulation, because it is going to change how we practice dentistry. Now, just to be full transparency, this program is sponsored by Philips. So thank you so much, Philips Sonicare, for bringing this valuable information to the healthcare providers in an easy to understand format and attend format. Tonight, we're going to cover a lot of things in a lot of information in such a small time. So it's going to be a lot of information in the classroom. You guys also should have a downloadable note-taking guide. This is going to really help you kind of digest the information once you leave here tonight. So we're going to go through how to describe like what is actually happening, because all of us have that engineering patient or that patient that always wants to question us in the chair. You guys know exactly who I'm talking about on these ones. So you need to understand what is happening. We need to understand how to maintain a safe environment in the practice, whether it's for the provider or the patient, and what some contraindications may be in certain circumstances. We're going to evaluate different devices that are out there, because there are so many devices out there, just like all of the other tools that we bring into our operatories. And then everything in this presentation is backed by evidence-based studies, protocols, research. It's not just a biased situation. It's from multiple different areas. And then what are some indications we're going to use it into our practice? Now, the probably most important thing is the top 5 PBM procedures that are currently being practiced in our operatories today. So let's start with kind of the elephant in the room first. Is what is photobiomodulation? Well, let's break it down. Photo is light, bio is living cells. You guys are dealing with that every day. And then modulation is just how do we influence a change, but how do we influence it in our favor in this situation? And so what it's doing is you're doing this change by using non-ionizing energy in order to start this reaction. Now, just a little bit of history behind how this all started, where it came from, is in 1966, Dr. Andre Messer, he was one of the first people to actually start studying the use of photobiomodulation. And it was in a study that they were injecting these tumors into rats, and they were trying to decide if this energy would cause them to grow. But in the study, it actually showed reverse effects. It actually showed that it would reduce the size and it didn't stimulate the cancer cells. It actually inhibited that growth by using a very low level of energy in order to get a cellular response. And so Dr. Messer, back in 1966, he is the one that coined the term that we hear a lot today, and that's the word biostimulation. So whenever you think about it, it actually started with photobiomodulation. When we look at it, though, we have that photo, so that light component. We get the most results out of our tissue or out of the cell when we're using it in a red to infrared spectrum. So when that energy is super, super low, we're able to stimulate a response and actually penetrate deeper into that tissue. And when you're closer to that 660 nanometer wavelength, you can actually inhibit more inflammation. You can get pain relief. You're accelerating the regeneration of those tissues. And it's actually another form of acupuncture, but without the needle. So if you're afraid of needles like I am, this is an amazing alternative that you can actually implement within your practice. Can you do all of the acupuncture procedures? No, we are not experts in that. But I'm going to give you some tricks on ones that you can actually use tomorrow should you have a laser and you're laser certified in your state. So, what you're doing with your energy is you're going to take your light source, whether it's a PBM specific device or even your diode laser that's sitting next to you. You're taking that light source and you're putting it to the cell. When you're doing that, you're energizing it. You're getting excited. You're starting a response within the cell. You're not having to have it travel through the body like a medication or a pharmaceutical. You're able to get it to the cell specifically. So now you're able to treat medical conditions and support overall wellness within the cell, but also the body. Now, we have so much going on in our operatories already that you're probably thinking, how am I going to add yet one more thing in already a time crunched procedure or time crunched appointment? I'm a hygienist. I work private practice, so I completely understand. But it will make your job easier and your patients will be happier because you're going to have shorter chair times. You're also going to have something that's accepted by the patients. A lot of our patients, even ourselves, know about red light therapy because the dermatologists have done an outstanding job with getting the word out about it'll stimulate collagen and do all these great things. But we can do that in the dental office as well, but on a smaller scale. Now, with photobiomodulation, you're also reducing the pain intensity, you're stimulating healing, and you can actually coagulate an extraction site or a surgical site before the patient even leaves. So most of the time when you're implementing PBM or photobiomodulation, you don't even need the sutures that you once needed. But it also can support you if a procedure doesn't quite go as planned. Maybe a patient forgot to tell you that they're on blood thinners. How many times do you go through an entire appointment and the patient says there's no medical changes until you get to the very end? And you know from your scientific background that something is not right. Some information was not shared to you. This is where you can utilize photobiomodulation in order to kind of help curve when the patient isn't always completely honest. Because I can't tell you how many times a day I have to explain, I'm not just cleaning your teeth, I'm treating your entire body. Your mouth is the gateway to the rest of the body. So let me know what is going on with you. Now, with every great thing, there's always limitations. Some limitations that we might face is transportation of your patient. Can your patient come into your office for multiple treatments? Or do we need to look at something that we can do, show them how to do it in the operatory, and then send them home with a smaller device that's over the counter or something along those lines? Is it cost prohibitive for that patient? Do you have enough chairs to put a patient in should they need to come in for a TMJ treatment or something along those lines? Each procedure we do, there's always some kind of limitation. And so honestly, in my practice, one of the highest limitations or most frequent limitations that we run into is the patient's availability to come into our office because they already have 1,000 other appointments. So how do we work with that? So we're going to kind of go over a couple of those and how to get around them as we go through tonight. Now, what is something that you need every single day? It's light. Light impacts our sleep-wake systems. And so when you're, up in the Northeast and, it's cloudy, you need lights You need those sun lamps. You need things along those lines so you keep your 24-hour rhythm, because that's how your body repairs. That's how you regulate temperature. That's how you know your external cues is from light and temperature. Well, what we're doing is we're condensing that with our light sources. And so by doing that, we're also getting better absorption of certain vitamins. Now, this chart is, I'm a visual person. And so this is something that I take kind of, a little bit more important to me, is because when I'm thinking about how I'm going to be treating my patient or I'm going to talk to them, I want to know how deep is that energy penetrating. Well, if I'm working on the TMJ or I'm working on like my occipital, because I went to the ergonomics class, but I did not follow what they said past the week, I want something to go a little bit deeper for my pain and aches. And so that's where I'm going to go up a little bit more in my energy. I'm going to be on that near infrared. Now, if it's, not as serious, if we're doing an extraction, we're doing, limited opening, something along those lines, or even sinusitis, I'm going to go more in that visible. So when I'm selecting my photobiomodulation devices, I'm looking for that 660 to that 810 range, basically, or even up to that 940 if I'm also looking at some sleep apnea treatments. So when you're selecting your devices, you need to know the wavelength, you need to know the power of it, because that's going to also help you know how long to treat an area for. When you've now selected your device, you need to know what's happening, because you don't want to put the tissue or the area into a trauma response. We're trying to heal. We are preventive specialists, whether you're a dentist or a hygienist, we truly are trying to help those patients. And so photobiomodulation follows that Arnott-Schultz law. And in case you didn't study all those laws, it's known as the Bispheric dose response. So in layman's terms, how much energy does it take for the tissue to absorb in order to create a response that's favorable in what we're doing? And so the lower the doses with this energy, the higher response you're going to get, because we're just basically plugging that mitochondria in. Remember, it's the powerhouse of the cell. And I know many of you just said that as I'm lecturing, because it was ingrained in you in like 7th grade. So we're going to go over the different phases that occur as soon as you put your device to the tissue. So the primary phase that occurs is your release of that reactive oxygen species. And so this is what's starting to get that change to occur. So it's starting to signal things over. Now, when you've got your reactive oxygen species starting to kind of get stimulated and that disassociates, other events start happening. So think of it like a domino effect. When you hit the big one, which is your reactive oxygen species, you start getting all of these other beneficial responses within the tissue. And it only takes you a few seconds to start this reaction. Now, the first thing that happens is you start getting pathways signaling. There's, signals going out. Something is occurring. The cell is starting to change. Some antioxidants are starting to go. Now we've disassociated our cytochrome C oxidase. You probably didn't think we were going to be talking about all of this biology since, you're not freshmen anymore. But we're going way back because it starts at that base layer. So once we get that disassociated cytochrome C oxidase, we now start getting into the real meat of what is helpful for photobiomodulation. So in just a few seconds, we're able to increase our ATP production. We're getting that disassociation of your nitric oxide from your iron and your copper in your blood. So now we've got anti-inflammatories going. You're now starting to get a promotion of those keratinocytes proliferation. And so when that happens, That's what making up 90% of your epidermis. So now you've got wound healing happening because everything's dilating. You're getting all the nutrients to the area that's considered injured or that you're repairing. Now that we've started that chain, that's not the only things that are happening. So now from those main effects, we now are breaking it down even more. What we're getting is we're getting degranulation of that mast cell. We're able to control that inflammation directly at the site. That's huge. We're not giving them a pharmaceutical. We're using their natural occurring body and their mitochondria and stimulating it with light. Yes, it has to be at a certain wavelength, but we're getting this chain reaction to go. Now, as our last phase, that's, right before you are starting this whole process over with that energy, you're now getting a relief of the inflammation, you're getting cell proliferation, and now that wound healing is in effect. And in case you're a visual person, this is that whole cycle. You've got the signaling, you've got ATP production. Your mitochondria is basically getting plugged in without a pharmaceutical. So there's no side effects or no byproduct, no dry mouth we're dealing with. And we're able to get the body to repair on its own. Little help with the plug-in, but we're able to start that repair. Now, this process can also start with bone remodeling with your osteoblasts. No, I did not take this pano. I just loved it because it's smiling at you. And some of us need to smile after seeing some of our patients today. But why might this be important for us? As a hygienist, I can tell you periodontal disease. Because if my patients have a furcation or a four-wall bony defect, that's very difficult to treat. And if it's a four-wall bony defect, it's very difficult for our periodontists or our, doctors to put a graft in there. The likelihood of success goes down dramatically. But if we can stimulate those osteoblasts naturally with our light and different devices that we can have chairside, that's going to help our patients. Plus, they're going to be able to clean these areas better on their own because the furcation won't be there, because we can stimulate and fill that in. These photons, they are producing a chemical change within that neuron as well. And so what we're doing is, even if an area is not traumatized, you're still getting repair in the area. So something to think about would be Bell's palsy patients. You're able to use this light in order to get a non-trauma area starting to repair. So you'll eventually, it takes several treatments, but you're able to stimulate that nerve. So that way you get neurological branching and you get repair of the myelin sheath. All you're doing is using light. An example that you can use is how a plant uses sunlight for photosynthesis, as an example. And so this is something that is kind of newer that's coming around, but it's been around since 1966. So we are finally moving forward and studying it in many more applications. Now, something to think about is if you are not putting the light to the tissue or to the area you're trying to affect, you're going to get no reaction. And so that's just the Gradus-Draper law. So without absorption, there's no reaction. How many of you have had to deal with this? Probably many if you've been in the field for a few years. The first FDA treatment that was approved for photobiomodulation was actually for carpal tunnel syndrome. And they're showing in several research articles that if you utilize photobiomodulation in your mild symptoms, this is not your more severe, those still unfortunately require surgery, but in your mild to moderate cases, you can actually prevent surgery from occurring. And with that, you're not in the pain. You don't have the tingling in your hands or your arms or your fingers. And I can tell on the days that I am not sitting properly, or I've had all the patients who cannot lean back in my chair, but they lean back fine in their bed patients that day. I can feel that fatigue in my elbows and my wrists because I've changed my ergonomics. And I should not, I know. But I will utilize photobiomodulation on myself, and I feel like a new person. I've been practicing for 20 years, and I honestly, I used to have so many aches and pains, and now I am comfortable. I don't, count down the days. So I'm out of pain on a couple of days in the weekend to recover. And then Monday starts over. I'm good. I can do my photobiomodulation. I feel great. I've increased my circulation, and I'm healthier overall also because of it. Now, photobiomodulation, these are some of the devices that are currently on the market today. The ones that are on the left-hand side of your screen, those are more your take-home devices or your devices that your patients can purchase over the counter. Are all devices over the counter created equal? Absolutely not. And so this is something that you guys can utilize or send your patient to some websites in order to purchase these ones. I've vetted those two. But then your other ones, like your Thor, that one is an incredible photobiomodulation device. And then you have some of your diodes that you guys already have chairside. You guys can absolutely utilize those. And Julie, to answer your question, she asked if photobiomodulation can help treat full body problems. And absolutely. You're just getting really excited because we're going to talk about that, which I'm happy to hear. We're actually going to talk about some of the other things that you can treat photobiomodulation for, or that the medical side is starting to treat photobiomodulation with. Now, settings, there's always a setting. I did not go to hygiene school in order to do math. I can do my anesthesia equation and I can do photobiomodulation equations. That is about it. But what you're looking at, and I got really excited, is you're looking at 1 joule per 1 watt per second. So if you have a 1 centimeter tip, that means you're giving 1 joule in about 10 seconds. And so that's kind of how you do your math when you're figuring out all of those equations. And we'll go through the top 5 so that we have it and you're armed with it to go in Monday or tomorrow if you work Fridays. Now, photobiomodulation has been approved for over 20 years. In 2015, though, it changed from low-level light therapy to photobiomodulation. So it's more of an all-encompassing. But a lot of people, we just like in, some of our dental terms that have changed and we still refer back, it is still the same thing. It's just more all-encompassing. Now, what are the main approved uses of photobiomodulation? We deal with this. Pain management. Dentistry gets such a bad rap because of the post-operative pain, whether it's, the rubber dam causing discomfort or the injection site being sore. Usually it's not the actual dental procedure that's causing the issues. It is more what we're using to isolate or control or have that patient open up. Now, another one is your inflammation. And this is something that is huge in our area because usually it's the swelling and inflammation that causes the most discomfort. Now, items to think about or consider when you are getting ready to utilize photobiomodulation on a patient. Main considerations is, what is the wavelength that you're utilizing? Because if I'm using a 810, nanometer diode laser, I only need about 20 to 30 seconds to achieve most of my results. But I also need to use specific eyewear or eye protection to protect the patient as well as myself. Because we want to make sure that you're being protected. Now, yes, there are some photobiomodulation devices out there specifically for your eyes, but do not use these ones that we're talking about on your eyes without, an ophthalmologist guiding you in that area. The infrared sauna that Amber, you're asking about, it does have some of these benefits because you're getting vasodilation. It's just not going to penetrate as far, but yes, you're absolutely still going to see a lot of those benefits that you are wanting to achieve that we're talking about now. Now, when you are utilizing your laser, you also need to be using a sign like this because you need to make people aware that they need to have the safety eyeglasses or the eye protection before they enter your operatory. So on any entry point or anywhere that somebody can look into your operatory, you want to make sure that you have that protective eyewear. It also helps liability-wise if you have these signs up at any entrance into your operatories. Now, caution absolutely needs to be used when you're using a diode laser or a photobiomodulation laser or device on a patient that lacks normal sensation. Meaning if your patient has the Bell's palsy, like I mentioned a little bit ago, also if your patient has had a stroke or any type of nerve damage, you wanted to make sure that it actually is having normal sensation if you can. If not, you need to make sure that you have indicators. So you're watching for that tissue reaction, so kind of a tinge or a tint. When a patient is telling that doesn't hurt, but you can see their lip kind of trembling, you're going to be looking for those physical indicators when you're working with a patient. Now, do not go onto Amazon and look to see if there's attachments, or not just Amazon, any third-party distributor. If there is any attachments that you can put onto your device, whether it's your laser or whatever, you want to make sure it's actually tested and approved for your device. You don't want to, use something that's BioLays when you're using a Gemini because it's not going to interact properly. And then that puts you at a fire risk, but also puts the patient at risk for potential harm or damage. Liquids should always stay away from these devices. They are electronic devices. I've never understood why my patients bring that cup of coffee or drink into the operatory with them. It's like they have no idea what we're doing, that we're working in their mouth. But they will then go and put it by the most expensive thing in your operatory, which generally is a laser or your, ultrasonic or something along those lines. So just make sure that you are moving it away from your devices. Now, personally, I sometimes get a little feet happy. Think of Happy Feet, the Penguin movie. I will push the wrong pedal. And so sometimes I will have a pool around my ultrasonic. I have now moved my PBM devices to another counter. So that is not actually a risk either, because you never know. Some days are a little more difficult than others. Now, there are different variables that you need to consider when you're treatment planning for photobiomodulation. And, some of those variables, what is the power output? Do you have 100 watts like what this laser can put out? Because then it's going to take me less time. So instead of 30 seconds, I'm looking at 21 seconds, something along those lines. Also, we're looking at distance from the skin. Do I put it directly against the skin, or is there space? Because if there's space, my energy density is then changing. So it's not going to be as impactful at a high dose. So I'm actually going to be stimulating a little bit more if I'm working on a TMJ or sinuses or something along those lines. Also, what about range of motion? This is a device that we have started using in my operatories or sending home with the patient because the patient can easily put these on and it wraps around covering most of the muscles of mastication. The patient wears this for 20 minutes at their home and they're not coming in 2 to 3 times a week for discomfort or pain. We're able to send that home. Now, there is no motion with this. With some of the other devices, say it's an 8 millimeter tip, I need to be moving that over the entire area. Also, you need to know what the patient is on the Fitzpatrick skin scale. And if you are fair or albino type like me, I mean, I'm barely a 1. So I don't have a lot of melanin to absorb this light energy. Those of you that have beautiful skin and that dark melanin, it's going to take you less time to absorb the energy because at this wavelength, it's actually going to cause it to absorb a little bit faster. Now, Nicole, when we are looking at our lasers, some of them can go directly to the skin. So that means our energy is going to be higher at that point because there's no diffusion of it. When we pull back on the tip or there's a spacer, that space causes the energy to diffuse a little bit or change the density. That's what I was talking about, the distance there. And hopefully that helps a little bit. Now, something else to think about for your patients is the patient wearing makeup? If they are wearing makeup and the bronzer looks just beautiful, but it has mica in it, the mica is a reflectant. And so you just need to wipe that away. So that way you don't cause any issues or reflect it in that because it won't absorb in that area. Oh, and Veronica, yes, Veronica has a very good point on the questions here. She said that she accidentally put her laser pen into the ultrasonic. Do not do that. That would also be a very high source of liquid and a very bad day. And so that's where we really want to get in there and make sure that it stays away from water, whether it's submersion or not submersion. Then something we need to look at is the area of we're treating. Now, this area that I'm treating on this patient is very, very small. We are treating her after she had endotherapy from our doctor. She had endo on number 8. So what we're doing is we're treating the apex of that in order to vasodilate it and get that infection out of there and stimulate those osteoblasts. That way we don't have that periapical radiolucency down the road. We can stimulate healing. Now, what are some procedures? We are finally into procedures. Y'all are probably finishing dinner now. So now for the good stuff. Procedures that you can treat with photobiomodulation. These are quite a few of them that we have in dentistry. Now, this isn't all. We have a whole nother page that we can do with photobiomodulation. Are we going to be able to cover all of these tonight? Unfortunately, no, but we're going to cover the top 5 that I use in my practice and that I have seen across the country and actually globally be used into our practices. So tonight we're going to go over TMJ because that's probably absolutely number 1. We're going to go over mucositis, bone loss, nausea and gagging, and post-extraction. Those are the ones we're going to focus on. Now, in the note-taking guide that you guys are able to download, you get some bonus content since you're spending your Thursday evening for me. So you're going to actually have a few more breakdown of procedures in that note-taking guide. Number 1, TMJ or TMD. A lot of our patients have it. A lot of us have it. Now, the protocols do change based on the chronicness of it. So if you've got a patient who has been struggling with TMJ, you know how you have some patients who have to take a break during treatment or they don't want the bite block. They say it hurts, things along those lines. These are the patients you want to treat with PBM first. So that way they're comfortable through the entire procedure. Now, I would recommend starting out with 10 sessions over a couple of weeks. And that's where that limitation of your transportation comes in because they're only coming in for 60 seconds at a time. Technically, it's 120 seconds because you're doing it bilaterally. You don't just want to treat one side. Now, if it is slight to moderate, where it's an occasional situation, then you are only going to be treating it maybe one session a week until the patient's comfortable. Now, each session can range from a few seconds to 10 minutes. A lot of times my patients are happy after that one session. Now, if it's a chronic thing, it might take a couple of sessions. And you always want to go directly where that pain or discomfort is coming from. So you're going to palpate. For those of you as students, I'm sorry, but it's never where they told me the pain was going to be in school. So I always have to palpate because every single person is different. So I'm going to palpate and I put it directly where that patient is experiencing pain. I'll do a session. I have them slightly open, see if they're having any discomfort. If they do, then we do another treatment. Now, post-operatively, you want to make sure that they're using a small toothbrush. I love this A3 head. I don't know if any of you have used it before, but this thing, it's slim, it reduces the plaque more, and it comes out on their new toothbrush that they have that my patients are also absolutely loving, including myself. It's got the pressure sensor, so they're not going to, traumatize, and they're aware of their pressure that they're exerting, but also they're getting a better clean. I absolutely love this. Now, here is an over-the-counter option. I actually travel with this. So if you guys come to any of my lectures or see me out and about, I will probably have this with me, especially if I'm traveling to Austin or anything like that. And I will wear it for 20 minutes after a lecture, and I'm good. And so this is something that you can send your patient. It wraps around, it has 2 pieces, and then that's it. And it's rechargeable. I have a QR code later, Sandra. And then note-taking guide, it should be on the email that you got or the link for this. But we will make sure that you get the link for the note-taking guide because this is a lot to digest in a very little time. Now, oral mucositis. This is something that our patients deal with more than we're probably aware of. And with that, we're managing the oral mucositis with PBM. Now, this picture is actually of a personal friend. She has a type of brain cancer. And so she was getting this where she's, 9 years old at the time, and she wouldn't eat, she wouldn't drink. Her quality of life was greatly diminished. And so this is one of the things that truly engaged me and had me dive into PBM because I believed what I was seeing. It was almost unreal. So for her, we did treatment on her where I just shined it in the mouth. We did about 60 seconds, and that was it that day. And so because we had to do upper and lower. But the next day, I realized that it was actually a user. I didn't retract. So everything else was healing. It just was not in the vestibule. So now when I retracted in the vestibule and treated, 30 seconds lower, 30 seconds upper, and then we did go down her throat a little bit for 30 seconds to get what was down the esophagus. We did that every day for a week. It has been over a year and she has not had these lesions come back. And so what the research is showing that if you can actually do this treatment before the mucositis even erupts or comes to the surface, you can actually prevent it in these patients. This is groundbreaking. I know that even Methodist Hospital here in Houston is starting to put information about photobiomodulation for oral mucositis into their navigating packets. When someone gets diagnosed, they're given a packet. Well, now they've got photobiomodulation information actually in those packets to help the patient kind of navigate through this. Now, this is a little bit more severe case. This device that this gentleman has is actually one I use on my own children. And this is for bone stimulation, but also mucositis. And my children over Thanksgiving had hand, foot, and mouth because I have a little child. She brought it home. It's spread. Yay. When your children are in pain and they can't eat and drink, you look for all options. After one treatment in 24 hours, those lesions in the mouth were gone. So then we used my other photobiomodulation over-the-counter devices for their feet and their hands, and they were comfortable, and it got us out of that painful period at a much faster rate. It absolutely will help with lichen planus. Matter of fact, we are going to do a little study on the famous Anne Guillain with this as well. And so lichen planus, it's huge for those patients. Now, this is a product that has not come out yet. It is in the final stages of getting FDA approval, but it's like a sucker. And it's great for pediatric patients because they can just put it in and it does the top and the bottom. I am so excited for this to come out. They're projecting by the end of the year this will come out. So this is going to be a game changer in our world because the patient uses at home. This one mouthpiece, that's the retainer looking one, use it 3 times a day for 15 minutes for your mucositis patients. And after 6 weeks, she had nothing. She had no ulcers, no burning tongue, no sores of any kind, and they have not come back, which is even more incredible because once we take that treatment off, my natural thought was it was going to come back. And it has not yet. And it's been 2 years for this lady as well. Now, something that we all need to be watching for actually as providers is there is some research starting to be done about magic mouth rinse. If it's compounded and it is on the shelf for too long, like the patient leaves it on the counter, it can actually become a carcinogen. And so that's something that we all need to be aware of and keep an eye out for as that research evolves. It's not 100%, but there are signs showing that may be where we're headed to on that. Now, this is something I find incredibly interesting is that when we're taught photobiomodulation in depth, we're taught to aim away from any tumor that you may see in the mouth, any oral cancer, so HPV, things like that. But in multiple studies, it actually showed for carcinoma in Sioux that when they put a direct exposure with 36 joules, that after 72 hours, it had started to shrink. The number of clusters had decreased, which carcinoma in Sioux is incredibly aggressive and almost a death sentence. Now, with it, though, with your mucositis, because those are open sores after your treatment, you need to make sure you're using something to lower the plaque. So it's important to keep the biofilm super low while you're healing with photobiomodulation. And again, I cannot recommend an electric toothbrush over a manual. And we can give you all of these guides also that you can see them in office and show your patients how it's treating. I promise I'm going to answer all your questions. All right. My number one thing in my chair, nausea and gagging. How many times do you guys say you're due for x-rays? The doctor would like me to get, XYZ depending on the patient. And the patient's like, I need the child sensor, or I gag, or I don't want to. We hear that all day long. And so something that we've started implementing is this, because now I'm not doing this whole circus act to try and open these contacts to get that interproximal decay. I can actually do photobiomodulation on these patients on the P6 in order to cut that sense off for about 15 to 20 minutes. Now, I want all of you to look at your dominant hand and take 2 fingers and lay it on your wrist. At the edge of that second finger, that's where your P6 is, right there on those tendons. You're going to place your device there, and that's what's going to give you that reflex. Now, for this certain device, so the Gemini here, it's 60 seconds on that dominant wrist. Now, if it is a strong gag reflex, you know, the ones that you walk in the room and they start gagging, do it on both wrists. It's going to give you a longer period of time so you can get true x-rays versus the x-ray that you place it and they move it as soon as you go out of the room or you place the Nomad, whatever it may be. Now, this is a case study that I love, and I show my patients, this is what a laser or your photobiomodulation can do. And what it is this patient had a traumatic, that you can see that it has an abscess there. They did do endo there, but that whole lingual wall is gone. They didn't put any bone graft there. What they did was they used the BioLase actually in this area, and they held it there for 1 watt continuous on their pain therapy setting. After 2 sessions, they were able to regenerate that lingual bone within 6 months. That is 6 months different. Because as soon as you apply your red light therapy to it, you're stimulating those mesenchymal cells and you start that whole process to form those bones or form that bone. Now, this is also a device that we utilize because honestly, to get a patient in there that much, not happening that much. And so you can tell the patient, hit the button once, it's going to give you illumination on the right. Hit the button in the front, illumination, hit it twice, illumination on the front, third, right? And then you can do another one and it illuminates that whole area. This is what we utilize the most. And so that way we're able to send the patient home with it for our perio, our gingivitis, our implant, and that QR code will get you to the website that has the TMJ wrap as well. That way you can kind of go directly to their site. And this is what we utilize in my office, so that way you can use it. Now, they don't teach a lot of this in dental hygiene school. They have started teaching it in some dental schools, but there is so much that these instructors are having to get into the curriculum that is very hard to add more to it. Now, the science behind your bone regeneration is when you take a tooth out, hygienists do not take any teeth out. Doctors, when you take a tooth out, you can still use your bone graft. So you're still doing everything as normal, but when you've cleaned it out and the socket starts to fill with blood again, that's when you're going to use your laser energy in order to get it to those osteoblasts. That's going to start the ATP process, and you're going to get better integration and better healing within that site, because it's also decontaminating. Now, I'm sorry if you're eating dinner, these photos are kind of gruesome, but what you're also able to do if it is a bone graft is you're increasing the porosity, because the graft material is going to be what's considered cold. And so when you put it in there, your natural bone will integrate or fill into that grafting area better, because you've vasodilated it and you've gotten the ATP there and you've gotten your, all of your stimulation of your blood flow in that area. Now, when you're doing photobiomodulation, you can also decrease the conduction of your C fibers within the tooth. So if you're seating a crown, you can use photobiomodulation at the apex for about 60 seconds. And that blocks that sensation for about 10 minutes. So you can actually seat the crown without having to inject or anesthetize that patient. Post-extraction, we talked a little bit about this already, but this is where you're going to do it on those multiple extraction sites on that tooth. So your mesial, your root, your distal, and then right there at the occlusal. I know that there's not occlusal because you took it out, but that's going to stimulate that blood flow in the area. And then you're going to get coagulation immediately. So then it's staying clean and your risk for dry socket is dramatically reduced. This is a study showing that if photobiomodulation is implemented with your third molars, that even at that periodic 6-hour control, 24-hour control, that the pain was still greatly reduced on the patients that had photobiomodulation utilized with those third molar extractions. I really wish this was around or utilized when I had my wisdom teeth extracted, but hindsight's 2020. My children will be using it. Now, what else is photobiomodulation being used for? I know we talked about it a little bit. One of you got really excited and asked more questions, but these are the top things that medical providers are currently using photobiomodulation for: migraine, pain management, whether it's diabetes, neuropathy, fibromyalgia, trigeminal neuralgia. It's a lot of those issues. And now they're using it to help heal the brain for opioid use disorder. With those, though, our devices will not work because it has to penetrate a little bit different. So this is called a transcranial device, where it sits on your head and there's a little rod that goes up the nose a little bit, and that's how they dispense the photobiomodulation to you. Alzheimer's disease, they're showing that when you combine your photobiomodulation, so that transcranial helmet, with CoQ10, it's actually showing that it slows the progression of the disease in animal studies right now as much as like Aricept, which is incredible, because if we can do this with our body and a supplement, you're going to have less side effects. We can slow disease, and maybe we can eventually find cures for Alzheimer's disease and dementia. Photobiomodulation with brain disorders is becoming one of the most important studies and utilizations that they are seeing in decades. This is something that we can actually finally move ahead of medical and lead the way in this. Now, with COVID-19, I know we are over COVID, we are moving on, but a lot of our patients have scarring and issues from that. They're actually showing that if you use it on the lungs or on different areas of the body, you can repair that lung damage, and the patients can then restore their smell, their breathing, and they can return to how it was prior. The medical community is using it more for inflammatory issues, but it's still relatively new. We can lead the way in dental. This is where we can kind of jump in the front and use it. If you guys have photobiomodulation devices, and I know some of you have mentioned that you have like the luminescence and some of that, that you guys can start utilizing photobiomodulation tomorrow. And so let your patients know that you can do red light therapy. Now, Nicholas just asked about hair growth. Yes, they are utilizing photobiomodulation in our oncology patients to stimulate the hair follicle so it's not falling out. So you're going to see helmets like that, but they are over the counter. The Lumibox does work this way as well. It's creating shorter chair time. Patients are happier. They're not having to be in pain. That inflammation is controlled. There's less pharmaceuticals. And you can set a clot, because how many times do you have a patient tell you that no one gave them post-op instructions, yet you know at least 3 people, the dentist, the assistant, and it's written in front of them? You can control post-operative pain and your complications. Breaking news, I know somebody just asked. As of January 1st, there are now 2 CDT codes for photobiomodulation. So I encourage you all to look at this book, look in the 9000s, but there are 2 codes that can actually cover photobiomodulation because it is now in your CDT code book. It does still depend on that insurance contract, but be the change. We can do this. If we start having happier, healthier patients in our chairs, we're going to lead the way and change the way dentistry is thought of in the community. I know this was super short and I'm getting ready to go through the Q&As with you all, but if you want more, I have a 3-hour on demand. Here's the website. It's $99 because y'all sat through this part, but this is something, if you guys just want more to it, you actually come into my operatory and see me do these procedures on my patients. Thank you. Thank you. Thank you so much, Sonicare. Phillips, you guys are incredible. Thank you for allowing me to present this. Now, if you guys have questions, here is my contact information. You can follow me also on Instagram. I do little like things within my operatory that can show you how to do different techniques. I go over different procedures in case you just need like little hints and things like that. We have a few minutes, so I'm going to go through the Q&A. So if you thought of something, go ahead and put it in there. And I'm going to go to the top. Yay, Colby College. Sorry, this is not a question. But I grew up in Ingalls, Kansas. And so I literally got the heck out of Dodge. And now I live in Houston. So yay. That has nothing to do with anything, but I just thought I would let y'all know. Have I used photobiomodulation on my carpal tunnel? Yes. So when I'm at home, because I live in a state that I have to have direct supervision, I do not use my chairside lasers. I have a couple in my offertories that I use when I'm at work, whether it's my Gemini or my Sirona. But if I'm at home, then I actually use that PBM head wrap one that you saw for TMJ. That allows me to wrap it around my wrist. I can take care of my 3 children or run around, and I'm more mobile. That one takes a little bit longer because it has less power, but it still gets the same results. Now, the wavelength on your intraoral devices, whether it is in your operatories, that's going to be on a yellow sticker that is on either the side or the top of your laser. That will give you your maximum output and your minimum, but your reps are a huge source of information if you have any questions regarding what you have. The Fontana laser is a little bit more, but I mean, that's also a little bit more expensive of a laser. It still has the sticker, but that's actually like a 1064 laser. Novolab, great. That one also works well. What you can also do with like the mouth guard or any of your diode lasers that can go intraorally, you guys can treat any inflammatory process. What you can do, whether it's periimplantitis, periimplant mucositis, pericornitis, you still have to clean the debris out, but that's going to help get that inflammation reduced faster so that way your patient's out of pain. Because a lot of times it happens on a holiday or after you've told them they need to get something fixed or do certain home care and they don't listen until it's a holiday. Scleroderma, yes, but because of usually the wide area, it's better to use the one that the dermatologist or the one that Thor has because they have a huge handpiece that you can utilize for that. Herpes, it can help with herpes simplex type 1 lesions, but instead of treating the lesion, you're actually working with the lymph nodes. And so you go to the, your submandibular lymph node, you treat it, and then you do your one right there on your collarbone, and that helps drain it out of the head and neck area. Let me see here. Sorry, I want to make sure that I get all these. I do. So for my more severe perio patients, we absolutely recommend like that mouthpiece that we utilize. We give the patient the website. They can go to the website. They can then order it and it ships directly to them. That way our office is not assuming the overhead because things are expensive for an office. And so we don't want to increase the overhead, but we can purchase them in bulk, sell them in the office if you want the overhead, or you can have the patient go on and order it. If you guys do order the devices because you sat through this, they are giving a discount to dental providers. If you do JBOC10, it'll give you a discount of 10%, but it's something. Stated 15 minutes for gag reflex. Is it required to do 15 minutes of red light therapy for 15 minutes before taking? No. Once you do the red light therapy on your P6, you then have from that point on 15. There's no waiting for onset. It's cutting that signal for 15 minutes. So yeah, absolutely go ahead, take right away, and you're good. Photobiomodulation doesn't work very well for sensitivity because the energy density is too low in order to change the viscosity of your dentinal tubular fluid. So I would still recommend using, one of the products that we currently use, or even your diode laser, and doing it in that treatment. See if I've answered most of those. So, Marina asked a question about the red light therapy chambers at the gyms. They do work, but it depends on what wavelength they are and what brands, because not all of them will penetrate as deep as some of the other ones. I love the Thor one. I am lucky enough that the place not next to me, but close to my house where I live, actually has a stand-up PBM bed that is amazing. And it's a Thor bed, and I take full advantage of that. So it is nice to have you here. Thoughts on BioLaser? I'm going to answer 2 more questions because we're almost out of time. And so what it is, let's see here, the BioLase, it works well. It has a pain therapy setting. They've had some manufacturer issues, but I know it is now up and going. Our tips are now coming back in stock for BioLase, so we can use it chairside. But they have a pain therapy piece as well as a whitening wand. You can utilize both of those for photobiomodulation. Oh, yes. You use the Fontana laser with PBM. Amazing. It's going to get deep in there. It's going to do great. You can use, David, you can use both. Sorry, the questions, Miriam, they're only for us on the presenter side. So the cranial one off of Amazon, definitely look at the wavelength of it, and also look at it if it's approved and not from like an off-market place. So you want to make sure that it's manufactured in a representable area and not somewhere that, you wouldn't, that you would trust. Sorry, I'm trying to look for the right words. Regarding certifications that are needed to do this, honestly, it depends on your state. What you need to do is follow your Practice Act. If you need to be laser certified in your state, you would then need to be laser certified in order to do photobiomodulation with a majority of those devices. The only devices that you would not need to do that is if it's an over-the-counter device that the patient can purchase and they do the treatment on themselves. And so, yes, I actually use the red light for me. I am a little type A, and I am in some stressful situations. I have 3 kids. I'm a past president of the state, things along those lines. And I work full time. So type A, clinch, grind. Since I've started utilizing PBM, I've actually regenerated posterior bone in my molars. And I've only used it consistently on me since Christmas because I'm trying out more and more devices, and I am not a compliant patient, if that helps, Juliet. And we're noticing on me when we take my x-rays, when we started to even last week, there's improvement. And we're measuring it with AI to make sure that it's not like angulation, things like that. All right. Oh my goodness. Yes, for fibromyalgia. Yes, for aphthous ulcers. Yes, you can use the head wrap for trigeminal neuralgia. I almost need to do a follow-up for all of these. And so the code for what, Christina? If it's for insurance, it's going to be your 9128 and your 9129, but you didn't hear it here. You looked at your book. After gingivectomy with a laser, the crown was delivered in 31. Absolutely. The tenderness where the laser was used, most likely the laser was a little bit hot or warm in that area. So you had a little bit of tissue charring. What you can do is, depending on which laser you utilize for the gingivectomy with that crown, You can take the tip off and do 30 seconds of PBM on the site that's tender. That's going to help repair that area. And then if you don't have that, you can use your fiber and pull back to change your energy density. But my email, I believe, is still up. Let me see here. Are we able to? There we go. Okay. If you guys can still see my email, please email me these questions. And I am going to be happy to answer these for you because we are out of time. The module of this material, yes, this module is actually recorded. And I believe, and Viva Learning can answer that. I believe it's going to be up for 6 months. So you can go ahead and read all of this again or listen to this loveliness again. But I'm happy to answer any questions. Email me, text me, whatever it may work. But my contact information is here for all of you.